Welcome to the Slop Farm. Enjoy the video.
In this video, I will explain how to study A&M Nursing Course. Start by mapping your syllabus into weekly modules and allocate focused blocks for theory and practice. Use active recall with flashcards and spaced repetition to cement facts like drug names and immunization schedules. Mix study with hands-on practice and clinical simulations whenever possible. Form study groups to discuss scenarios, teach peers, and get feedback from instructors for steady improvement. Organize your study routine around consistent habits and realistic goals. Begin each session with a clear objective and a timed focus period to build momentum. Alternate reading with hands-on practice, using mannequins or simulated patients to link theory to skills. Track progress with weekly quizzes and adjust plans for weak areas. Maintain hydration, sleep, and short walks to keep energy and concentration high throughout intense study weeks. During clinical rotations, concentrate on mastering essential procedures and documenting experiences in a clinical log. Practice communication for consent, handovers, and patient education to build confidence. Use past exam papers to simulate timed tests and identify common question patterns. Pair up with peers to teach each other difficult topics, as teaching reinforces memory. Schedule regular reviews and prioritize sleep.
Thanks for watching. Consider subscribing if we helped you today.